I am all over the board. I am a mixed bag of emotions and thoughts and feelings. I'm still very scared. Hey everybody, and welcome back to my channel. I apologize that I need to talk a little quietly. My toddler is sleeping right now and I don't want to wake her. But I had sort of a positive update that I wanted to share on my channel as I continue to document my TTC journey. If you haven't seen my most recent video, I'll post a link down below if this topic interests you. But I had mentioned in my last video that our TTC journey has been put on hold, possibly forever, because I have some symptoms still relating to a birth injury I sustained a year and a half ago when I had my daughter. I go into great detail about the symptoms and everything I went through in the video that I'll link in the comments below if you want to go back and watch that. But just briefly, I'll recap. I had a very quick transitional labor. I delivered my daughter in under 30 minutes, but honestly she came completely out in just 2 successive pushes, and she also dropped pretty quickly into my pelvis during that transitional period. So I'm pretty sure that the way I delivered her was what caused my birth injury. But my injury briefly was that I tore somewhere around my pubic bone area, and I had a lot of like extreme pain and bruising and bleeding, abnormal bleeding, for like 2 months postpartum. And then all that pain actually just went away one day, and then it all came back. Well, not all of it, but a lot of it came back with my first postpartum menstrual cycle 1 month later. So let's see. So I got my first postpartum period around November, somewhere around November, December of 2016. And from November, December 2016 up until September of 2017, every time I got a period, I would experience some extreme pain, basically in like my whole lady area, but particularly around my pubic bone, and also like extending sort of a little bit into my groin. And I had mentioned this to general practitioners and midwives over the course of the year, and it just seemed to be a mystery to everyone, and they told me I needed to pursue it with a specialist, which I never did, because starting September of last year, the pain went away. Like I didn't get the pain during my periods from October 2017 up until last month, the end of January 2018, when it came back. And so between those 2 time periods, we had decided to start trying to conceive, and I thought I was all better. And then these symptoms came back, and it suddenly dawned on me that something could be wrong with me anatomically, and I should probably get myself checked out before I get myself into a position that could put me into some extreme and possibly disabling pain. So, to continue my summary of my last video, I had emailed the specialists here to try to get an appointment, and while I waited, I emailed my practitioner in California. As you can tell by the name of my channel, I live in Sweden, so I'm sort of at the mercy of the healthcare system here. But I called my old OBGYN in California, I emailed her, and asked her if she had any idea what might be going on with my body, so that I could start offering suggestions to make the most of my time when I meet with a specialist. Because I would really like to try to conceive and not wait forever to get diagnosed and see if this is sort of like a dangerous situation I'm in. So she talked to a specialist, and the specialist said I might have nerve damage. I might want to look into getting an HSG done to see if maybe I have like a leak in my uterus that could be leaking menstrual blood into my body and causing all this pain and discomfort I get only during my period. So those were suggestions, and they terrified me. But I have since done a ton of Googling, and I finally found the right combination of keywords to get a hold of medical journals and articles and forums. Granted, they're old, but a lot of forums online where women talk exactly about what I'm experiencing. And so I think I'm on the right track of figuring out what I have. I think I have something related to SPD, which is Symphysis Pubis Disorder. It's most commonly experienced by women during pregnancy. And there's a bunch of different things that can cause it, but I think one of the main things is that some women either produce too much or are maybe hypersensitive to the hormone relaxin, which is pumped into your body. I think all throughout pregnancy, honestly, but particularly toward the end, and it loosens the ligaments and joints up in the pelvis to allow for easier childbirth. That is gizmo. But if the joints and ligaments and everything are loosened up too much, it makes the pelvis extremely unstable and super painful. I never had any symptoms of SPD during my pregnancy, and I'm inclined to think I don't actually have SPD. I think what I have are still symptoms and complications related to the birth injury I have. However, the one extremely interesting thing about SPD, which is what I finally found in forums and medical journals, is that this pelvic girdle pain gets worse during menstrual cycles. And there are a couple reasons as to why, but the main reason is because some women produce relaxin during their menstrual cycle, even when they're not pregnant. So from what I've briefly read on medical studies, ironically the one main study I read was actually conducted here in Sweden. It was previously thought that relaxin was only produced by the female body during pregnancy, but they did a bunch of samples on I think like 77 women, the report I read said, I think, and they noticed that the women who have symphysis pubis pain or pelvic girdle pain also tested positive in blood serum levels for relaxin. So now they're looking into what is producing this relaxin in women. Because like I said, I guess previously they thought that it was only produced during pregnancy. Now, I had not actually researched human anatomy, at least this part of human anatomy, up until the past couple days. So I've done a little Googling just to familiarize myself with the body, and I've learned some interesting things. What I actually thought originally was that the pubic bone was like a kneecap, it was like a solid bone. But it turns out, of course, that it's two bones that are not fused together. So, and that's so that it can, the pelvis can relax for childbirth, so the bones can come apart. But in between the two bones are like ligaments and also a cartilage-like disc that I believe they call the symphysis pubis disc that sits in between. And so you can tear, you can rupture, you can damage those structures. And that's what the specialist told me she thought happened to me when I went in for like a 6 or 7 week follow-up after I gave birth to specifically look at this problem I was having, the pain and the abnormal bleeding and the bruising and everything like that. So I think that's what happened. I don't know if I have scar tissue, and maybe it's just, maybe my pelvis is trying to loosen up during my menstrual cycle, and I have this scar tissue, and there are so many nerves in there, and it's just becoming very, very sore and painful because of that birth injury. But another thing I read that could be the cause is, and I'm going to butcher this word, I think it's diastasis. Diastasis, I think that's it. A lot, and it's abnormal separation. And so another thing that could be the problem is that my pubic bone, for whatever reason, didn't really go back to the position it should be, or perhaps that my pelvis is aligned that's causing the pain. Now, I will say I'm on cycle day 11 now, and I have been like acutely hyper aware of my body situation down there over the past couple weeks, because this is like a very big topic of interest for me now. And I have noticed that I do have extremely low levels of discomfort and sensitivity exactly where my original injury was. So I don't only have the pain during my menstruation. It actually is there always. It's just so slight. So again, I kind of don't know what's wrong with me, but I feel very confident that I'm on the right path of figuring it out. And the way that it would be diagnosed is either through an MRI, an X-ray, an ultrasound, or even just a manual exam. That's the first bit of like positive news in all of this. But the second bit of positive news, you guys, is that, you know, here in Sweden, they have this nationalized health network where you can write your own referral. So I did that, and I did receive confirmation that the hospital received my request and they were processing it, but it just wasn't enough for me. Like I'm so eager. I wanted to push it along. So I finally got on the phone with them, and I talked to this woman and I explained everything I was going through, and the way she treated me on the phone suggested that what I was saying sounded familiar, or at least not weird. So that gave me a little bit of hope. But then she told me that I had been booked for an appointment on the 28th and that I would receive the confirmation in the mail soon. And I was so excited, I forgot to ask her what month. Because when I was talking to her on the phone, it was February 19th. So it was a couple days ago. And she said I had an appointment on the 28th. I love our healthcare here, at least the healthcare I get. I have no complaints, but I do live in a socialist country, and socialist countries are rather notorious for having long wait times to get in and see doctors, especially specialists, and especially if you're referring yourself, right? So it seemed highly unlikely to me that I was going to get my appointment on February 28th, and I was pretty much gearing myself up to get this letter in the mail and find out that my appointment is on March 28th, which would mean like a whole month and a half of waiting and a whole nother cycle gone. But you guys, I got my paperwork, and check this out. February 28th is my appointment at 8:30 in the morning. I am so stoked. I just was so thankful and so happy that I don't have to waste a whole nother cycle, a whole nother month just to get in and have my first initial appointment. So when I was talking to the woman, I asked her, is it right to start with the gynecological department? And she said, yes, I would be seen by a doctor, and they would figure out what the problem is, and then I would be referred to a physical therapist in that department if that was the path that they thought I needed to go down. So I am so excited. I'm so excited, and I'm definitely going to be posting videos and updates you know, when I go for that appointment. But I'm really looking forward to asking them, well, besides figuring out what's going on, asking them if this is something I really need to wait and treat now, or if this is something that perhaps is minor enough that I could like either not worry about it or go through treatment during a pregnancy, which is what I know people with SPD usually do. And another really good thing is I got my first positive OPK for this cycle yesterday, which means I should, according to the pattern, probably ovulate today sometime, which means today is the day that I should be experiencing ovulation pains. They were gnarly last month, and I had mentioned in a previous video that I finally called my doctors here and said, is this something I should be worried about? You know, because I didn't have ovulation pains before. It's only been in the past 4 cycles or so that I've been feeling this. So they told me that they want me to take over-the-counter pain relief if I get it this month, And if the pain goes away or it goes down significantly, then we're all good. But if it doesn't, then I need to call them and schedule an appointment. So today we'll see if I get ovulation pains, and if I do, I'll take those medications, and if the pain doesn't get any better or if it stays pretty intense, then I can kill two birds with one stone and bring it up to the specialist at the gynecological department next week. So it's a double whammy of good news. It's funny because yesterday I was feeling all the ranges of emotions. I, at one point, was convinced that this issue that I have is absolutely going to be a source of horrible pain during any future pregnancy. It's going to affect my desired delivery, and that maybe I should just delete this YouTube channel and give up TTCing and enjoy the baby I have and the healthy body I have and just give it up. I went from like that extreme to getting my positive OPK and texting my husband and asking him if we could just try. If we could just try once again this month and see what happens. So I am all over the board. I am a mixed bag of emotions and thoughts and feelings. I'm still very scared about the diagnosis and the prognosis and what I could potentially face. I don't like the fact that there's a lot of variables and there really just might not be any way to know how bad, if at all, my pain gets during a future pregnancy. And all of that just makes it very difficult to balance the logic versus the emotional side. So I will find out, you guys, next week what the sitch is and how long I'm going to need to be redshirting from the TTC game. This is a step in the right direction. So stay tuned if you want to figure out what my prognosis is. But thank you for watching, and subscribe if you want to follow along with my journey. Otherwise, I will see you all some other time, okay? Bye.